Know that they ride or die. I keep boys by my side. Know that they ride or die. I keep boys by my side.
Day we hustle, but the night we
Know that they ride or die.
Hey, what's up, you guys? I did this story earlier. I went live, and unfortunately I had to erase that video because my little champ decided that he wanted to push the recliner and smash the dog. And so when the dog screamed and I got up, he started hollering. So I felt kind of weird about allowing that video to stay up. So I wanted to bring this story about the GOP is outraged at $30 million Biden plan to fund crack pipe distribution in efforts to reduce drug harm. This is not going to reduce any drug harm. This is only going to allow them to get high at their convenience. They're going to keep coming back. They're even talking about setting up a place where they can get methamphetamine injections so that they can use their drugs, and in case they overdose, they'll have Narcan on site as well, so that if there is a drug overdose, they can counteract the reaction. I think this is going to be a disastrous plan and a disastrous situation. I see disaster, and it's targeted towards the African American, and please forgive me if I say it wrong, the LBGTQ plus community. And I don't think that is right, because this is going, you already have people that's out here struggling, and they're saying that the reason why is because they got people that are using drugs, and they're using glass crack pipes, and they're getting cut and getting sores, and they're passing germs. Why are you giving them crack pipes? You shouldn't be like helping them. There was some kind of bill or something passed in the 1980s when the crack epidemic was at an all-time high, where people were actually in their what they call those, the crack houses and things of that nature. And then they had something that says that the people, the normal people, can't, like, not oh God, I get tongue-tied. Normal people, normal citizens cannot sell drugs or do anything like that, but the government can do it. I think that nobody should be doing it. So I think this is a hot mess to me. So it's gonna keep black people and other people that are drug addicted using drugs. So if you're gonna have staff that's going to be monitoring the people while they're getting their injections and they're smoking their drugs, who's going to monitor them if they're actually addicted to drugs? So that's going to be my question. Who's going to monitor the monitor? So it says conservative legislators are outraged by recent reports that a Biden administration drug harm reduction program may put some of its funds towards safer smoking kits. That doesn't make sense. That's just an excuse to keep these people using drugs and dumbing them down. On Tuesday, U.S. Senator Marsha Black of Tennessee wrote on the Department of Health and Human Services, expressing grave concerns that a $30 million grant program from the Substance Abuse and Mental Health Services Administrator could include subsidizing drug paraphernalia. That's really crazy. So you get to go and say, hey, I need a pipe. Can you give me some money? I'm a crackhead, and you don't smoke. So many people are going to be using that as an excuse to get free money, to defund, to fraudulently get money, is what I'm saying. I'm sorry, I'm getting tongue tied. That it's gonna be a mess. It's gonna be an absolute disaster. Government funded drug paraphernalia is a slap in the face to the communities. At first responders fighting against the drugs flowing into our communities from a wide open southern border. Ms. Blackburn wrote in her letter, if this is the president's plan to address drug abuse, our nation is in serious trouble. And that's true. We are in serious trouble. That is the dumbest thing that somebody could possibly ever put out there. Why would you do that? And you have all these dingbat Democrats that's going to rally around, yeah, that's cool, that's cool. What about your child? What about your family member that's struggling to get off drugs? Now they're telling them, hey, because you're a crackhead, we're going to give you free money to go get you a pipe so you can smoke in peace. That's dumb. So all those people that did all that work to help to get these people off drugs and to help them create a better way of life for themselves, you're telling them, come on, we're going to give you a free crack pipe. That's just it's disastrous. The controversy stems from a recently disclosed request for proposal under the Harm Reduction Grant Program, part of the Biden administration efforts to lessen the impact of drug addiction on marginalized communities. The initiative also intends to fund facilities offering safe syringe exchange, opioid reversal drugs, fentanyl test kits, and other methods meant to stem the United States striking drug overdose crisis, which kills more than 100,000 Americans between the year of 2020 and April of 2021, May of 2020 and April of 2021. But this still is not going to help. What you do is you create stronger and better programs that's going to help the people to get off the drugs. You don't give them something that's going to help them stay on the drugs. And then if they overdose, you're giving them Narcan, which is going to say, oh, every time I overdose, they're going to give me Narcan so I can keep doing it and I keep pressing the button and I can keep pushing the levels. What about those children that have family members that are doing like crack cocaine and meth and all those things, that sticking themselves up with heroin and stuff? You're encouraging them to continue to do this kind of stuff, and there's going to be a whole lot of children that are going to be sitting here looking for their parents that are high as a kite, because you know once they smoke that dope, people that are on crack cocaine and stuff, they smoke dope and they're gone for days at a time. So you're legally allowing them to smoke dope and not knowing whether they have kids at home, so they go off on their high and they sit up here and they're gone from their children. What about the children? What about a better evaluation system? What about a better monitoring system? What about helping them by finding a drug that can help them get off of the drug instead of inducing the drug and allowing them to smoke the drug like fentanyl and all this good old stuff? You're going butt backwards, as my family would say. You're butt backwards. A description of the program reported by the Washington Free Beacon says funding could go towards smoking kit supplies. The Beacon added that the HHS spokesperson explained these kits could include pipes that could be used for drugs like crack cocaine. See, this is ridiculous. This is absolutely ridiculous. This president has lost his absolute mind. The prospect that the federal government could be funding such activities outraged fellow Republicans, including Senator Tom Cotton. Is this a cruel joke? And I'm thinking that it is. The Arkansas senator said on Twitter on Monday, calling the program crack pipe distribution. And this is going to lead to a whole lot of stuff, you guys. It's going to lead to a whole lot of bad things. Really, really bad things. Drug overdose deaths are at their highest record level. The Biden administration should focus on stopping traffickers instead of creating more demands for their products, because what you're going to do is you're going to have the drug cartel. They're going to be like, cool, we can bring in more dope. Yeah, because now they got a program where they can get crack pipes and we can keep on selling our dope. This man is clearly not using his brain. This man seems like his health is declining. He's going backwards. And I don't see how all these people can sit here and cheer him on with the stupid stuff that he's doing. HHS says that Biden's crack pipe distribution plan is blatant misinformation, bullcrap. But they don't deny the report. I don't care what they say. I believe that they're going to do it because it wouldn't have been put out there. Once again, misinformation just means true facts that make Democrats look bad. They don't want to tell the truth until it happens, until all these people get out here and get addicted on this crack cocaine, and then they're going to find out that Joe Biden really was lying in the first place. So this is crazy. The harm reduction grant offered by the Substance Abuse and Mental Health Services Administration and authorized by the American Rescue Plan is a grant program designed to help Americans who are struggling with substance use stay healthy and safe, prevent drug overdose deaths, and find pathways into evidence-based treatments. You guys are not finding any treatments. You're giving them crack pipes, according to the report. A spokesperson said in a statement to Fox News, like all programs that use federal funding, these grants must adhere to relevant federal, state, and local laws or regulations. The Justice Department told the Associated Press on Monday that it is currently evaluating whether it would be legal to operate safe drug use sites and other harm reduction measures within appropriate guardrails. This marks the reversal from the agency's stance under the Trump administration, which successfully sued to stop the opening of a safe injection site in Philadelphia. So they're doing everything ass backwards. Exactly. Such harm reduction practices meant to lower preventable illnesses, overdose, and death associated with unsupervised drug use is already used in places like Canada, Australia, and Europe. The American Medical Association has endorsed harm reduction measures like safe syringe exchange and drug test kits. Cities like Cincinnati have already experimented with offering safe smoking kits and other supplies, which some health experts argue can prevent the spread of disease like hepatitis and allow people using drugs to test if their supplies are laced with deadly fentanyl. Okay, so this is really out of the people are really out of their mind. So I don't know what to say about these people. We need all options for people to get safe injection supplies, safe smoking supplies, fentanyl test strips, and Narcan, so they can stay alive. Linda Cedar, I think that's how you say her name, executive director of CARCO, a nonprofit HIV and AIDS organization in the area, said last year of the privately funded effort, this is a crisis. Exactly. Why would you do that? Because a lot more people are going to be using those same crack pipes, and they're still going to be doing what they're doing. People are still going to have those diseases, and still they're going to take those legalized crack pipes and go somewhere, and they're going to share it, and it's going to increase everything that's going on. You're going to see more people on Skid Row because of drug addiction and drug abuse and drug use. They are not using their brains. A similar effort in Annapolis, Maryland area prompted controversy from local leaders. Absolutely dumbfounded. Carl Snowden, chairman of the Caucus of African American Leader in Arundel County, I don't know how to say it, said last year of the program handing out safe drug use kits, it was inexcusable and unacceptable. So I guess this is one of the places, it looked like one of the cubicles that's going to be used, which I think is an absolute disaster. Local health officials, meanwhile, said the kits and stop overdose and allow providers to offer people who use drugs more health services and support once a contact is made during the exchange. So if you handing these kits out and you say they can smoke in that area, so everybody gonna be getting a contact in a minute, and they're gonna be using dope, and some people are gonna get a contact high that never had drugs in their system before. So they need to really think about what they're doing and how they're doing this. I don't think they should be handing out anything that's gonna escalate use of drugs. Then it's gonna be out of control. And I'm sure that a lot of people are not, these states are not reporting everything that's going on. They're just saying, oh yeah, we got this, you know. So you're encouraging and you're trying to spread the word so they can open more places so that more people could get involved in this crap and then lose their life. This is really, really out of, I don't understand. Once we get past the no, let me see. Local health officials, meanwhile, said the kits and stop the overdose. Kits and, or shall I say, the kits can stop overdose and allow providers to offer people who use drugs more health services and support once a contact is made during the exchange. Once we get past the visceral reaction, we get to the point of helping people. And Arundel County Health Officer Dr. You know what? I am not fooling with that name. I told y'all, if I don't know that name, I'm not fooling with it. Doctor told Fox Baltimore in April, I'm not doing it. Harm reduction advocates say they understand that drug use is dangerous, but that interventions like safe needles exchange and safe smoking kits can help eliminate unnecessary suffering. No, it's not. It's going to increase smoking. It's going to bring the drug cartel in. It's going to bring y'all money in. It's going to have people that are actually trying to recover from drugs to be enticed to re-smoke again. It's going to cause a lot of stuff to happen. It's going to be a bad counter effect, and nobody's going to want to take the blame or responsibility when we have an out of control situation where there are people dropping down and passing out because they are not using those things in safe areas. They're going to be stealing some of those kits. People are going to be lying about being on drugs to get the funding so they can go buy other things like drugs instead of buying the kits. This is just a whole mess. We recognize that using drugs introduces risk, but there are ways to make it safer. The National Harm Reduction Coalition writes on its website, people can reduce their risk of HIV and hepatitis, overdose, and other drug-related harms by applying evidence-based harm reduction strategies around safer drug use. This is ridiculous. Late last year, the Biden administration unveiled a 4-part plan to tackle drug addiction, including slowing the overprescription of opioids and supporting harm reduction strategies. We are willing to go places where our opinions and our tendencies have not allowed us to go. HHS Secretary Xavier Becerra, told NPR at the time. So you got these people running out here telling you that it's okay for these people to get high, smoke dope. What about the children that's going to suffer? What about the families that's going to suffer? Like I said before, I know people personally that used to smoke drugs. I know, and they have recovered. But when they used to smoke drugs, they will get high and they will be gone away from home for a number of days. They will come back hungry, stinking, and crazy looking. So this is not a good idea. This is not a good look for our president. I don't care if Canada's doing it. I don't care if Botswana doing it. I don't care if Mars is doing it. I don't care if Jupiter's doing it. Just because somebody is doing it doesn't mean that it's the right thing to do. So they need to stop with the, oh, this place is doing it, that place is doing it, this place. They need to cut it out. Literally, they need to cut it out. This is no excuse. This is no excuse. I am really outraged. All the people that put in all that hard work, and here you go with this foolery, and then you trying to lie and say that it's not true. How can you say it's not true when the U.S. Senate, Marsha Black of Tennessee, wrote on her daggone website and said that, you know, they're expressing grave concerns that the $30 million grant program from the Substance Abuse and Mental Health Service Administration could include subsidizing drug paraphernalia. How you gonna say that it's not true when you got these different people answering? They're answering this. Somebody named Miss Blackburn. They're answering what is being presented. So here we go with another lie, another cover-up. All they do is lie. And we sit here as blind sheep, as the Bible says, sheep being led to your slaughter. So y'all need to start thinking and using your own heads and stop believing everything that somebody's telling you. Like my dad said, get the information for yourself. Research for yourself. Look for yourself. Stop believing what people tell you. If somebody told you that it was sunny outside and you walked outside and it was raining, because you didn't take the chance to peek outdoors and look for yourself, that's your fault. What you getting mad at them for? You didn't do your homework. You need to do your homework. You need to be the one to pay attention. You need to be the one that take care of business and know what you're talking about and know what's going on. Don't depend on everybody else. Don't depend on people to give you the correct information. Look it up for yourself. Do your own research. So you guys, that's all I gotta say. But don't forget to hit that like button, that post notification bell, and that subscription button. And I want to thank Tracy. She joined me in the last one, but like I said, I had to get rid of it because I didn't want that sound of the dog screeching in the back, screaming and hollering, and the baby hollering and screaming because the dog got excited, and because the dog got hurt, he thought I was going to do something. What can I do? All I could do was get up and make sure the dog leg ain't crushed. That's all I could do. Well, anyway, everybody's okay, you guys. So thank you for joining the video. Leave your comments below, and I will talk to you in the next video, you guys. And don't forget, again, like I said, to hit that like button. Don't forget to hit that post notification bell, and don't forget to subscribe to